all go through traumatic events every day that are so impactful that even months post after the event, it can still strongly influence our day-to-day lives. You might fear something bad is going to happen, even though it seems completely out of our control. And because of that, you might have nightmares, flashbacks, as well as feel anxious. The feelings that we are feeling could be called post-traumatic stress disorder, or PTSD. And millions of people around the world go through this every day. Now, you're probably asking, what is PTSD? The different forms of PTSD comes in many forms, and the ways to help people recover, I will be talking about today. First off, post-traumatic disorder is a mental health condition triggered by terrifying events. Such events could be warfare, rape, and abuse. That could be either categorized as either physical or emotional. And sometimes they may become in the form of accidents, natural disasters, terrorism, and violent crimes. Although obviously upset following a traumatic event is normal, PTSD occurs when the feelings torture you for months mentally and maybe even years and become so extreme that they can even affect your life in various different ways outside of the event. PTSD is a mental health disorder characterized by symptoms such as flashbacks, nightmares, severe anxiety, emotional numbness, and avoidance of situations that may trigger those memories of the trauma. The symptoms can affect people's ability to maintain relationships, keep a job, go to school, or even take part in everyday life. Few people think of PTSD as a condition with many varieties. The first type of PTSD that we're going to talk about today is acute PTSD. Acute PTSD develops shortly after the trauma and lasts for less than 3 months. Some people experience extreme symptoms post PTSD trauma, can find support and recovery quickly with timely and effective treatment. The second type of PTSD that we're going to talk about today is chronic PTSD, which symptoms persist for months or even years. Chronic PTSD can severely limit individual life quality, and some people may develop depression, substance abuse problems, issues from relationships, trouble getting or retaining employment, as the system said to last far longer and usually requires some sort of professional treatment. For example, seeing a therapist, going out of town, just to get breathers, things of that nature. The last and final PTSD that we're going to talk about is complex PTSD, aka CPTSD. It occurs after sustained or repeated trauma exposure, as in cases like child abuse, domestic violence, human trafficking, or even problematic negligence, which can be examples of leaving your kid, something akin to like, what would you call it? Something akin to like orphanage and things of that nature. Alongside the features of PTSD, CPTSD is defined by symptomology such as low self-esteem, shutdowns, pervasive shame, mistrust of others, as well as challenges with emotional regulation. This impact can particularly be insidious and can happen over the course of years. Also, there is a condition that goes along with complex PTSD known as delayed onset PTSD. In this shape, signs can emerge as a couple months or perhaps many years after a disturbing episode. Some can appear later after being triggered by things that remind you of said trauma, and which may make symptoms emerge. While PTSD can be very painful, it is only natural that one can heal from it. In mental health, we have therapies such as cognitive behavioral therapy or CBT, eye movement desensitization, reprocessing, or EMDR, to process trauma and help us with coping mechanisms for the future. Sometimes faster helps can take the form of medication to alleviate anxiety, depression, or insomnia. The assistance of family, friends, and others in the community is also necessary to help with PTSD. Beings of compassion can create a huge difference in someone recovering from it. By learning more about PTSD, we can eliminate the stigma to other conditions affecting millions worldwide. Now that we know what PTSD, how it affects our day-to-day life, and we discuss the types of PTSD, which include acute PTSD, chronic PTSD, complex PTSD, and delayed onset PTSD, as well as the treatments and support systems we can use to help that, we should be able to recover the wounds that may leave deep marks and they can heal. Through raising awareness and providing care, we can help PTSD